Okay, so today we are going to do a physical exam on the adolescent teenager. Today we have the patient with initials MS, is an 18-year-old male, and weighs about 154 pounds. He's about 5 feet 10 inches in height, which puts his BMI at 22, which for his percentile would be about 50th percentile. We'll go ahead and take some vital signs here. How are you feeling today, Michael?
Good.
Yeah? All right. School going okay for you?
Mm-hmm.
Yeah. All right. So I'm just going to go ahead and take your blood pressure here for your right arm. All right. You can relax. Your legs are uncrossed. Okay, just like that. A little bit of a squeeze. Okay, about 118 over 75. Great. All right, respirations look to be about 16 breaths per minute. I'm just going to feel your pulse. Good, and about 72 beats per minute for our heart rates. Okay. So I will go ahead and start with the head to toe physical exam. Looking at his face to make sure everything is symmetrical. There's no abnormalities, there's no drooping or anything like that. I don't see any obvious lumps or protrusions from his head. I can go ahead and then just feel his scalp, look at his hair while I'm doing so, looking for any hair, if it's coarse, if it's thin, if there's irregular disbursement of hair. Everything looks to be normal. I'm not feeling any irregularities at all. I can then notice, again, the symmetry of his face. Can I go ahead and have you puff out your cheeks for me? Good, just like that. And then squint your face in. Yep, good. And don't let me open your eyes. Good, so he's got strength. You can relax. Good. Now I want you to press. I'm going to stick my hand here. I want you to turn your face towards my hand and don't let me push my hand. Yep, good, good, good. And again on the other side, push, push, push. Good, so that he's got good strength there. We can then assess his eyes, and I can note that his pupils are, when he's looking at me, they're equal and they're symmetrical. I don't notice any drainage from his eyes. Not one is not bigger than the other. They're equally distanced apart. His eyelashes are equally distributed. His glands don't look to be inflamed. His sclera is white. There's no redness. There's no inflammation or anything like that. I can then test his pupils and make sure that they're equal and reactive. So just look at my nose. Good, and they're reacting great. Okay, I'll test for accommodation, so follow my finger in. Good, and his pupils are closing in at the same time. Follow my finger one more time. I'll test the rest of the cranial nerves here. Just with your eyes, follow with your eyes. Good, good. All right, can you feel this here? And can you feel this here?
Mm-hmm.
And it feels the same? Good. Can you hear this? Can you hear this? And it feels the same. Good. Let me know when you see my fingers.
I can see them all.
Okay. So tell me when you start to see my fingers.
No.
Okay, great. So he's got good peripheral vision there. I'll have you, I can look at his nose. It is symmetrical. It's not crooked. There's no drainage. I can assess his nasal cavity and just look in. I don't see any deviation. I don't see any bulging. I don't see any inflammation or redness there. Any sinus issues recently? No. So if I press on his sinuses, he's not experiencing any pain there. No. And I can illuminate those sinuses here. Good. And they seem to be just fine. I can test, I'll look in your mouth here if you want to open and say, ah. So I'm looking for that soft palate to rise. Open your mouth again for me. Looking at gums and teeth and making sure there's no swelling, infections, or anything like that. Go ahead and stick your tongue out. Good. No cracks, lumps, or anything like that. And once you stick your tongue up, looking underneath your tongue, good. And everything looks normal there. No bumps or anything there. His lips are symmetrical. They're not cracked. There aren't any lesions or anything there that is of concern. I will have you say the letters D, T, N, L.
D, T, L.
And
L.
Yep, very good. So that is making sure that his tongue, the hypoglossal nerve is intact as well. I can test gag reflex. I'll have him just take a sip of water. So this will prove instead of having him gag, we can just make sure he swallows correctly. Good, and no issue there. I can then look at his ear and make sure, I can inspect it, make sure there's no drainage, no redness, no swelling, and looking at the point of attachment to make sure everything looks normal there. I can then feel and palpate, make sure there's no hard bumps or any swelling, and no pain with the ear as well. At this point, I'm going to pull his ear up and back because he's 18, closer more to an adult age rather than a younger child where you'd pull down and to the left. I'm going to pull up. So just going to look in your ear, looking at the eardrum. Everything looks normal. I've got that white reflect from the tympanic membrane. I'll look at the other side as well. And again, pulling up and away. Oops. And there's the tympanic membrane. No redness, no swelling, no earwax buildup at all. So the ears are looking good. To make sure we look at everything thoroughly, I'll assess his eyes one more time. I did check his pupils. I will look for his red reflex. So again, just stare at my nose. I'm going to shine a bright light into your eye. There's my red reflex. And the vasculature in the back of his eye looks normal. Normal optic disc and retina. We'll look at the other one. Again, look at my nose. Red reflex is great. And the vasculature looks normal there as well. Okay. Moving on to the neck, I'm going to look at symmetry to notice any abnormalities and maybe any glands, if one is protruding more than the other. I'll have you look up and look down. Good. So he's got good range of motion and can flex there. Can you shake your head no? Great. So he can move it both ways as well. Everything inspecting looks normal. So I can then palpate his lymph nodes, starting from behind the ears, under the jaw, feeling for any abnormalities, down his neck, and no abnormalities there, and supraclavicular as well. No abnormalities. I want you to raise your shoulders for me, and then don't let me push down. Don't let me push down. Good. So he's got good resistance there. Okay. That looks good for the HEENT. As far as respiration assessments, I'm looking at his difficulty of breathing. He seems to be breathing no problem. I'm looking at his chest expansion here. If I have him take a big deep breath, Good. My hands are moving symmetrically. I'm just going to make sure my computer opens back up there. Okay. I can then do some tactile for Matus. So I'm going to stick the balls in my hands right on your chest. I want you to say 99.
99.
Good. So I feel that vibration there, and again in the back.
99.
Good. So I also feel the vibration there. We can do a little bit difficult, just for modesty purposes, is the percussing on the intercostal space, and you're looking for the resonance there. A little bit hard to feel. His muscles are there, so it's hard to feel those intercostal spaces. A part of the, initial assessment of the skin as well, you're looking for any cyanosis, making sure that blood flow is flowing properly, and that there's no clubbing of the fingernails. Can I just take a peek at your fingernails? Good. So I don't notice any clubbing or anything there. So I will go ahead and do auscultate now. Starting, just take a nice deep breath in. And, yep, good. And just good. Inhale and exhale. Good. And left lower lobe. Good. I'll do the right middle lobe. And the right lower lobe. Good. Everything I'm hearing is clear. I'll do the back as well. Inhale. Good. Again. I'm doing a zigzag motion on his back to compare both sides. Still, everything I hear is clear. Good. Again, everything I hear is clear. I can also, at this point, just hold your breath for a moment. Listen for bruits in the neck. And then listen to trachea. So, big inhale. Very clear there. And then nice big inhale and then exhale. Good. After the respiratory assessment, I can assess the cardiac, his cardiac, do a cardiac assessment with him. Again, looking for any cyanosis or any edema in the legs that would indicate some cardiac abnormality. You can palpate the, you can do peripheral, feel for pulses here on the right and left radial. And then to feel them equally, to make sure that they're equal, and they are. And can also do the pita pulses, feeling at the top of the feet, and then the tibial behind the leg. Here. Good. So +2 pulses all around. Can also feel for the pulses mid-left clavicular in the 5th intercostal space. You can feel at the apex, and then at the 5th intercostal space on the left side of the xiphoid process is another place to feel. You can do the 2nd intercostal space mid-clavicular at the base, and the 2nd intercostal space on the left side of the sternum, and then on the 2nd intercostal space on the right side of the sternum would be all places to palpate a pulse. I will just listen in all of those spots to the heart. Oops. Sorry. Great. So I've got a S1 and S2. In that part, you've got a very good. Okay, great. I don't notice any murmurs. I've got a regular beat with an S1 and S2. We did already the peripheral pulses, and now we can move on to the gastrointestinal tract. So I actually will have you lie down if you don't mind. Put your head, yeah, there. So perfect. You can just like that, hands at your side. Perfect. Do you need another pillow? You good? Okay, so I'm looking at his stomach. I'm looking for any abnormalities. We'll just keep your shirt down. Any protrusions, any obvious abnormalities there. I can palpate lightly, looking for masses or anything here. And everything feels normal. I can then check for rebound tenderness. So if I press in and come back out, any pain? No. So no rebound tenderness there. Again, no mass noted. So liver, I would palpate. I can support the back here and palpate for liver and spleen here. I don't feel an enlarged spleen or liver by any means. At this point, I can then listen to his bowel sounds. And usually you'd like to listen first before palpating. So I'm starting at the ileocecal valve, moving up his ascending colon, across the transverse. They're still sleeping, I think. Alright, and then down to the sigmoid. Good. That is, I hear positive bowel sounds throughout. Again, ideally, you'd like to listen first and then palpate. For his age, I'd consider him as Tanner stage 5, as far as those stages go. I'll just continue through a musculoskeletal exam at this point. I'll have you raise your right leg and don't let me push it down. Good. And raise your left leg and don't let me push it down. Good. And relax. Can flex your toes up to your nose. Good. And don't let me pull. Good. And then press down on my hands like a gas pedal. Good. He's got good strength there. I will now have you sit up if that's all right. And I want you to go ahead and stand. And then just making your so tall. Okay. So I'll actually have you bend forward. All the way forward. So I'm looking for scoliosis here. I want you to you can take a couple steps forward. And so I'm looking, bend all the way over. Yep. So I'm looking for the curvature in his spine, mostly standing from back here and seeing, I'm looking for any angle or change here in his spine. That looks fine. So go ahead and stand back up. Thank you. While you're standing there, why don't you we'll test your balance. And I'll have you take your right heel and drag it up your left shin. Drag it all the way up. Good. He's got good balance and back. And do it with your opposite. So left, yep, all the way up. Good. And relax. I'll have you take your right hand and stick it behind your head. And then your left hand and stick it behind your lower back, showing range of motion of his shoulder joints. And then if you can do the opposite. Very good. So he's got good range of motion in both joints. If you can just kind of pretend like you're doing a bicep curl, this is showing range of motion of your elbows. Maybe do some wrist circulation. That's good. He's got good motion there as well. And hands, if you can flex up and down. Good. All right, go ahead and take a seat. We already tested your shoulder strength and your balance. Let's have you actually... You did kind of walk. I'm sorry, I'm going to have you stand up one more time. Walk towards that wall. And then back towards me. Good, so he's not, go ahead, and now go ahead and sit down. He's not shuffling his gait. He's not limping. He's got a normal gait there. All right, we did all of the neuro assessment as far as testing his cranial nerves. So we can go to some deep tendon reflexes. Again, I don't know how my hammer had left my kit, so I'm just going to walk through how to do a deep tendon reflex without actually having one. I'll just use this as an example. So in the adolescent, we can test the brachial reflex, deep tendon reflex. So what we do is with your non-dominant hand, hold the patient's elbow in your hand, and I'm resting my thumb, just relax here first so I can show, right in the crevice here. I'll have him relax, and what I would do with a hammer is strike my thumb. When I'm looking with the hammer here, what I'm looking for is a flexion upward, would be a positive deep tendon reflex. And I would do it on the same. For the patellar reflex, you just strike right below the patella. And then what I would be looking for is a kick out from the leg. I'm going to just wake this computer up here. Is looking for a kick out from the leg. You can also test the triceps and the brachioradial as well as Achilles. For the purpose of this, we're just testing the two. What else can we test with you? So we can do sensory tests of the nervous system. So I just want you to close your eyes. I want you to tell me if you feel where I am when I'm touching you.
My arm.
Yep.
Leg.
Yep.
Leg.
Good.
Wrist.
Okay, good. So he's telling me that he feels, he's doing both. So he can feel the light touch, and then he's telling me where it is. I'll test his pain stimuli. So close your eyes again and tell me when you can feel. Yeah. Okay.
Yeah.
Okay.
Mm-hmm.
Okay. All right, great. So he can feel that as well. I will then have you put your palms out. Good. And why don't you tell me what this is in your hand? If you grasp that.
Paperclip.
Yep, good. Keeping your eyes closed. What is this?
Pencil.
Very good. And then one more test with your eyes closed. I'm going to draw a number in the palm of your hand and tell me what number you feel.
3.
Good. So testing that sensory function as well. All right. So throughout this assessment, it would be important to look at skin, looking for changes in birthmarks, rashes, any acne, looking at fingernails to see if there's any signs of malnutrition, if there's any edema, if there's any rash or anything at all. I would also find it pertinent to assess his mood. I do know this is an early morning assessment for him, so a little sleepy, but otherwise he seems to be appropriate as far as mental status, following my cues, answering questions appropriately. He seems to be oriented ×3 and have a good memory as well. Just want to make sure that I am going through all of the things that I wanted to assess with him. And I believe that is it. So overall, with his an adolescent physical, he seems to be within normal limits as far as growth and height and weight in that percentile. And developmentally, his progressing at a normal rate as well. So he is really within normal limits. I don't find any thing to diagnose him with. And follow up in a year or two. Thanks.